Question: how do you fix a physician shortage without lowering the bar? Answer: you reform the education system. Here's the deal. Med schools largely are still teaching very heavily knowledge-based. The reality is we live in a world that's full of easy access to knowledge and information. So med schools need to change their focus more to continued knowledge, but in addition, increase the percentage of resourcefulness, adaptability that we're teaching the students. So how do you access the information that's already out there, and how do you directly apply that information in an efficient, expedient manner, right? What that then allows you to do is say, hey, maybe we can actually truncate the time somebody needs to be in medical school. Do students really need 2 years of basic sciences and 2 years of clinicals, or can we just shrink it down to 1 year of basic science and then go straight into clinicals, 1.5 years of basic science, go into clinicals, right? These are things just for us to begin considering, because that then allows us to get people through the medical pipeline faster and without losing, lowering the bar. And we don't lower the bar because heavily what we were learning in medical school now is easily accessed. So I don't need to memorize a billion different things if I can access it easy. You still have to have your base foundational knowledge, but now you can access everything else. So it's more about being resourceful, being adaptable to solve problems and actually apply those problems. And the reality is, honestly, they say you get your MD in med school or your DO in med school and you actually become a doctor in residency. I learned the practice of medicine during residency. That's where the emphasis and time needs to be.